I work with the complex care team, and that involves a nurse and an assistant practitioner, and we work in the community as part of the neighbourhood team. We work with the hospital teams, we work with the community teams, we work with the voluntary sector, we work with the dementia support worker, adult social care, all the voluntary sectors and anybody else who's working with people in the community. We focus on people being at the centre of what we do. We share the same value of person-centred care, what matters most to people, where they want to be, who they want to be with, and who's the right people to surround them with. The second thing that's really important in working in this way is we share the same values, but we also support each other as a team, and we work together to share responsibility. We can hold risk in the community, but we've also got the time to speak to relatives and carers, because it's important that we support the people looking after that person as well. One of the really important parts of the job is that we have time to speak to people's relatives. And I think that's really important because those are the people that are caring for people. It gives them space to express their wishes, and they often know the person best. So we can have that conversation and support them with the decisions that they want to make.
I had the pleasure of doing a GP role with complex care as part of my formal training in Foundation Year 2, which is the second year after we've graduated from medical school. And I really saw the benefits of working with the complex care team, with the skills that I developed and the relationships that I was able to build with patients and really get to know them and their families. And I loved it so much that I developed a role for myself to come back for an extra year to keep continuing to develop those skills upon those 4 months in my F2 year. So I really loved it. I think the main thing that I've taken away from this role is how to assess and establish risk and how it feels within myself. As a junior doctor in the hospital, we're very exposed and we have a lot of support by senior members of the team, as well as investigations at a snap of a finger, really. And in the community, that's a lot harder to establish, so it's working on your problem-solving skills, which you wouldn't have as much exposure to in the hospital setting. Having the support from my team, knowing that actually they are just a call away if I do need them, and we have a laugh, and I actually enjoy work. I wake up every Monday morning and I go to bed every Sunday evening looking forward to my day.
With working with the complex care team, we have been able to not duplicate things. So very much the patients have said back to me that they didn't want to repeat their story. So by sharing the responsibility of the person we're supporting and their carers, we can share their story, and then the families don't have to repeat their story several times. And I think that's been invaluable. We have also great feedback from the people we're supporting. And I also support the various groups, memory cafes, and we've set quite a lot of those things up in the community. We're building a dementia-friendly neighbourhood within the area that we're working. So all of those things together, it's just been really helpful to be part of this team.
The term people often use about person-centred care, if you have interest in people, it becomes person-centred, because if you find out what they like, what makes them happy, what interests they have, what life they had, it becomes person-centred, because you can get so much more from people if you value what they've done and what's about them. So it is person-centred, even if it's not necessarily all about medical things.
My husband had a diagnosis of dementia when he was age 70, and we found the diagnosis was called logopenic aphasia, progressive aphasia. Inevitably, we reached a crisis point where particularly our night times were very stressful and difficult. Deanna came to see us within a few hours of us having a referral and was very practical and reassuring about how the help that can be given to Oliver on the particular needs that he had. So we met the occupational therapist who came to see us every time Oliver's condition deteriorated, to see what sort of equipment or what sort of exercise, what sort of tasks we could be doing with him on a daily basis. His cognitive powers were pretty poor by that stage, and therefore it was a try this and try that, and it doesn't matter if it doesn't work, but let's try it. And we were very open as a team. We were supported every time there is a deterioration, which was almost weekly. Though if the phone rang at 7:30 on a Monday morning, it was always Dr. Deb. And your first question to me was, how are you? Not how was Oliver, but how was I? And the mantra was one day at a time. So person-centred care for Oliver and us and the family and the carers meant that every level of his care was attended to by the complex care team services, but also the complex care team enabled us to feel confident enough to administer the sort of help that was sort of instinctive, but one might not have been confident enough to do it if we hadn't had the team behind us.